अस्सलाम वालेकुम एंड वेलकम टू माय चैनल। आज के लेक्चर में हम स्किन इन्फेक्शन को डिस्कस करेंगे। सो फर्स्ट ऑफ ऑल मूव टुवर्ड्स द स्किन स्ट्रक्चर एंड कॉम्पोजिशन। सो स्किन इज़ द लार्जेस्ट ऑर्गन ऑफ द बॉडी. इट हैज़ थ्री मेन लेयर्स, द एपिडर्मिस, डर्मिस एंड सबक्यूटेनियस. एपिडर्मिस एपिडर्मिस जो लेयर है, इट इज़ द टॉप मोस्ट लेयर ऑफ द स्किन. इट इज़ द ओनली लेयर दैट इज़ विजिबल टू द आई. It is an elastic layer on the outside that is continually being regenerated. Function क्या क्या है? Production of new skin cells, production of melanin to give color to the skin, physical protection of the body, immune protection of the body. Dermis. So, जो epidermis layer है, it is a part of skin but it does not contain any blood vessels. So therefore this layer is dependent on the dermis. Dermis is thicker than epidermis and it contains all the glands, it contains blood vessels. So it is thicker than epidermis and contain all the sweat, oil glands. It contains hair follicles, connective tissues, nerve ending and lymph vessels. फंक्शन क्या क्या है इसके? सपोर्टिंग द एपिडर्मिस, फीलिंग डिफरेंट सेंसेशन, प्रोड्यूसिंग स्वेट, कीपिंग योर स्किन मॉइस्ट, प्रोड्यूसिंग हेयर. थर्ड जो लेयर है वो है सबक्यूटेनियस लेयर. सो सबक्यूटेनियस लेयर इज अंडर द डर्मिस एंड इट इज मेड अप ऑफ कनेक्टिव टिश्यू एंड फैट. फंक्शन ऑफ स्किन. स्किन क्या क्या फंक्शन परफॉर्म करती है? Provide a protective barrier against mechanical, thermal and physical injury, prevents loss of moisture, reduces harmful effect of UV radiation, act as a sensory organ, and is also helps to regulate the temperature, and it is an immune organ to detect the infection and production of vitamin D. So these are the functions of skin. In this lecture, we will discuss about the skin infections. There are many skin infections, but we will discuss only three: folliculitis, impetigo, and cellulitis. Firstly, we will discuss about folliculitis. So, folliculitis, as the name indicate, it is a common skin condition. Happens when hair follicles become infected or inflamed. So, क्या है कि hair follicles को वो damage करता है. It is the infection of hair follicles in the skin. होता क्या है basically, tiny pus filled spots will develop at the base of the ear. So the folliculitis है, it means inflammation or infection of hair follicles of the skin. Causative agent. Staphylococcus aureus is a causative agent of this infection. Folliculitis usually occur at the site where hair follicles are damaged by friction or shaving, or where there is a blockage of follicles. Treatment. Antibiotic cream may be useful. Fusidin cream is suitable antibiotic cream. तो ये एक ointment cream है, ये antibiotic cream है, एक ointment है. So it can be applied 3 to 4 times per day. If the folliculitis is more severe or widespread, then course of antibiotic tablet may be needed. Impetigo. It is highly contagious skin infection. It usually occur on the face, neck and hands of young children and infants. So it may occur in the children who wear diapers, also tend to get it around the diaper area. Symptoms. Non-bullous impetigo and bullous impetigo. Non-bullous impetigo में क्या होता है कि developing one or more itchy sores that quickly burst, and then red or raw skin where the sores have been broken. Swollen glands near the sores, forming honey-colored crust over the sores, but the skin eventually heals without scarring. और bullous impetigo में क्या होता है? Large fluid-filled blisters form on the child's skin, but no redness appear around the surrounding area. So then the blisters become clear and limp and then break open. Crusty sores form on the child's skin and then skin heals without scarring. Causative agent: Staphylococcus aureus and Streptococcus. These are the bacteria that are the causative agent of this skin infection. Who gets impetigo? Mainly it occurs in children being 2 to 6 years of age, those having skin irritated by other condition. It can be occur due to poor hygiene, due to warm weather, and if you are in a crowded environment where the bacteria can spread easily. Participating in activities that involve skin to skin contact. If you are having diabetes or your immune system is compromised, then there are chances to get this skin infection. Treatment: Ratapamulin is an ointment. It is relatively new class of tropical antimicrobials. This is recommended for this skin infection. थर्ड जो हमारे पास है वो है सेलुलाइटिस. सेलुलाइटिस is most common bacterial skin infection. It may first appear as a red swollen area, so that area feel hot and tender to touch. Then redness and swelling often spread rapidly. This cellulitis is usually painful. In most cases, the skin on the lower leg is affected. Cellulitis usually affect the surface of your skin, but it also affect the underlying tissues of the skin. It can spread to the lymph nodes and blood streams. Symptoms: pain and tenderness in the affected area, red or inflammation of the skin sores or rash that appears and grow quickly. So ये rapidly spread होता है. So this is painful. Tight glossy swollen appearance of the skin. Feeling of warmth in the affected area, कि वो affected area उस एक तो रेडनेस भी हो जाती है और एक वो वहाँ पे आपको एक फील होगा कि ये एरिया थोड़ा सा वार्म है. Central area that has an abscess with pus formation and fever will develop. Some common symptoms of a more serious cellulitis infection क्या है कि it occurs in a serious condition. Shaking हो सकती है, chills, fever, feeling of illness, fatigue, dizziness, light headedness, muscle ache, warm skin and sweating. Causative agent: Staphylococcus and Streptococcus bacteria. Treatment: different antibiotics are given. Cellulitis is presumed to be due to Staphylococcus or Streptococci infection, and it may be treated with different antibiotics like cefazolin, cefuroxime, nefcillin, oxacillin. So these are the antibiotics that are used in the treatment of this skin infection. So this lecture was about skin infection. Kindly like this video and subscribe my channel. Thank you and Allah Hafiz.